All right, so welcome to this live session, and we are looking at good morning, and welcome to this live session. We are looking at the spaces in the upper and lower limb. So we said three things you must know. We said know the spaces in your body, know the spaces in your body. So we're going to start with okay, excuse me. All right, all the spaces in okay. Let's pick no um okay, let's do it this way. Let's start with all the spaces in the body, then we narrow it to the spaces in the upper limb for first year students. Okay, and not only that, for MBBS, okay, those writing MBBS. All right, okay, the next MBBS they'll ask a question on spaces, so we will get to know all the spaces in the human body. We said three things you must know, which is it's very important, is an area of concentration. Number two, you get to know the outline, and then you get to know the sentences that you need. So we try to make it in an easy, wonderful way. We're sorry we are coming by this time, what we think. Sometimes it takes more time to do what is declared. All right, so let's quickly get to it. Okay, give us some time. We are still working to get you the best of information. We don't just want to be talking, we want to show you before we send it online. Okay, to show you some of the things we are looking at. Okay, good. So this is the first one here now. Exploring my body's super species. That is spaces in the human body. Right? Spaces in the human body. So as we talk about the spaces in the human body, you can see, no, that's not what we want to do. We want to look at all the spaces first. That's just for the thorax. Good. So this is a certain source that I push this up from. You can see body spaces and cavities. Easy to remember. This is front view. Okay, all the spaces in the front view and then in the human body. All right, so this source has 1, 2, 3, 4, 5, 6, 7. Okay, in the human body has this number of sources, and then on the side view it has um, on the side view you can see, all right, so dorsal back cavity, ventral front cavity, you can see the spaces. Okay, let's get another one. Let's get another one that considers all, another version of consider all the spaces in the human body. Okay, here's another version of it. You see, exploring my body super species. Okay, spaces in the human body, you know, the head, the chest. Okay, the head, the chest, you know, that's the thorax, the neck, you know, the lower limb. Okay, the upper limb. So let's keep moving on. Let's keep moving on. Spaces in the human body. Good. And this gives you, this another one, it gives you all the spaces in the human body. It gives you all the spaces. You can see spaces in the upper limb. You see the group that you have spaces in the, you can see there, spaces in the pelvis, spaces in the lower limb, spaces in the thorax, spaces in the perineum, spaces in the abdomen, spaces in the head and neck, spaces in the face, okay, spaces in the head. Are you seeing it now? Those are the spaces in the thorax, upper limb, lower limb, thorax, pelvis, perineum, you know, abdomen, like that. Okay. Let's see, do we have any other concern? I hope you are following. You are following. We're looking at, we say know all the spaces. Normally what we do, when we finish this, we send like a shot or like a small video, okay, across, because many people don't really see the screenshot very well sometimes until you zoom like this. When you zoom like this, you see spaces in the upper limb. So ladies and gentlemen, subscribe and share, okay, watch till the end, if not if, okay, and comment on the section. Okay, personally, I'm going to stop reduce the rate I'm doing this on YouTube, because um, you people are not really commenting. I'm not seeing commenting. Done over 60 videos, and then we are not seeing up to 60 comments. It's not really good. So I'm going to choose another platform where I'm going to have audience that I don't need to be the one recommending. Okay, so the platform is going to recommend for me. So you look for me in TikTok. All right, so Made Such Course Mastery will be on TikTok from tomorrow. Okay, or before today ends, will be on TikTok. All right, so you look for us on TikTok so that we can get viewers, can reach out to the thousands and millions of people we need to reach out to. From that, TikTok is going to help us to do that. Okay, because in YouTube, if I don't reach out to people, the algorithm is slow, because I have over 20 million videos every minute. Okay, so um, let's move on. This is for upper limb. You can see for lower limb. All right, can see the spaces in the hip and buttock. For example, in upper limb, those of us who are going to be writing MB, and those of us who are in year two, first this thing next year and whatever, can see how many spaces you have in the hand. Okay, how many space? 5 spaces. In the forearm, how many space? 3 spaces. In the elbow, how many space? Check closely. In the arm, how many space? Shoulder and axilla, how many space? Okay, so we're beginning to lay this foundation, and look at it here in the lower limb. So I've shown you 3 versions, okay, of summary of the spaces. Now I'm going to zoom down. Okay, I'm going to zoom down. You can see these are spaces in the lower limb. You see spaces in the lower limb. Okay, the thigh, you can see the glutea, okay, subglutea, inferior and iliopectineal space. You can see the spaces, and so there's space in the buttocks. It's not only the buttock that is big, there are spaces there, all right, cavity making it to be big like that. Okay, so move on. You see spaces in thorax. Okay, spaces in thorax. Let me bring this here. Okay, says pleural spaces, right and left pleural spaces, mediastinal, so you see the mediastinal spaces, pericardial spaces, see the fibrous, and so that's that. Anybody can do this that I'm doing. Just want you to drop in the comment section. Let's get to know if you are really appreciating what is happening there. Okay, so we move on to the next one. You can see the spaces in pelvis. Okay, peritoneal spaces, pelvic facial spaces, So the thing is, from your first preclinical year to your last clinical years, you're going to see spaces. So first in coursework, there will be space. Second in coursework, there will be space. Third in coursework, there will be space. So it's good you get to know spaces are coming. Spaces, they are coming. So now, you can see, I want you to drop on the comment section. We are trying to generate all this to make sure we have a more retentive way. Now, the video I sent to you, all right, it said, my amazing arm adventure, super easy mnemonics. Can you see now? So for this one, this is spaces in the arm, all right, shoulder and armpit. You can see there. This one gives you a clue, quadrangular space. We usually do like this. Okay, you cross the 2 fingers. People like doing this instead. So as an anatomy people, we talk about relationship of anatomy. Okay, we talk about fashion in anatomy, we talk about styles of anatomy, pattern anatomy, and we'll be doing that a lot. We'll be sending videos and materials across that will inspire. Okay, hope you can hear me. Okay, videos that will inspire and make it stick longer. All right, so all these things you're seeing as image will be trying to create kind of video from it, animation, and let's get to see. For example, you see a quadrangular space is a axeman in a square, and all this that I'm trying to do, trying to bring a whole three things I told you. Number one, it's so important. Three things you must know about spaces is that number one, okay, is an area of what concentration. You can't run away from spaces, either femoral triangle in lower limb, or the quadrangular or the triangular spaces lower limb. Of course, in thorax we also have triangular space, the large, posterior anal triangular space, and the small, you know, urogenital triangular space, okay, on the anterior, okay, that's in the peritoneum. There are spaces, so excuse me. Spaces is what we can't run away from. So it's one important thing you need to know about space. There's no level that you will not hear about space in your medical career. No level, no course. There will always be space. So it's good you get to know the space. Okay. Now, aside from that, we talk about the area. Okay, we've said it's an area of concentration. And number two, we said you need to know the outline. The outline. Number three, you need to know the mnemonics. Okay, so for the mnemonics, I need to tell you, right? And I will say this slowly. Okay, said I do love studying cool brains because real anatomy feels beautiful like charming ones. Okay, so since we're studying, we'll get the book as usual and be writing it. Okay, so when I mention it, you write it. You follow? When I mention it, you write it. Do you follow? Thumbs up if you are with me. Okay. So we're making progress. We have I. You write it vertically as usual. I don't know why I didn't do that here. Okay. Okay. So I do love. I do love. Hope you're writing. Cool brains. That's brain. Cool one. I do love cool brains. Okay. Because real anatomy. Because real anatomy, okay, feels beautiful like charming ones. Did you see my thumbs up in the space here? Snowbox superhero space about abductor pollicis longus, extensor pollicis brevis, longus, content radial artery. Okay, okay, so we move on, move on, move on. What else? Let's say what it stands for. Okay, I stands for introduction. Love stands for location. Okay, I stands for introduction. Because we say I do love, so I introduction, do for diagram, love for what? Location. Love for location, diagram location. I do love cool babes, cool brains. Cool there stands for what I call um, content. There are contents of every space. Okay, you see like this carpal tunnel, the wrist tunnel, or the Gayon's canal. The Gayon's canal. Okay, the secret shield. You have the ulnar artery. Yeah. Gayon's canal. Okay, you have the ulnar artery passing through it. Okay, and we say subscribe in such course mastery for more. You see, so that's what I hope you can hear me, please. If you cannot hear me, drop in the comment section. Hope you can hear me. I'm clear enough. All right. Mm, can you hear me? Okay. So let's move on. We are making progress, and we said if you have I do I do love cool brains. I do love cool brains. Hope you are writing it down. I do love cool brains. Why do I love cool brains? Okay, because real anatomy because real anatomy, okay, feels beautiful like charming ones. Okay, so what does it stand for? I there stands for introduction. Do stands for what? Diagram, right? Love stands for location. Cool stands for content. Brains, okay, stands for blood supply. Okay? And then let's not brain stands for blood supply because stands for boundaries. Is a boundary. Every space have boundary. Every space have something passing through it. Something in it. You know, there's a space for something. Said. So then we move on. We said I do love cool brains because anatomy that is apex. Every space have apex, has apex and base, has apex and base. Do you follow? Mhm. You don't have blood supply to space. You only have base of a space. All right, base of a space is a mistake. Is a base. So you have apex and base. Okay, fields. The field is the floor. So the floor and the roof. Okay. Mhm. So the say because real anatomy, real there is the roof. So roof and floor, apex and base. You must always remember that. Your roof has a floor, now is it not? So every apex will have a base. I mean, brain in skull anatomy of head and neck. We said the apex. There's something I just wanted to say now. Yeah, the base is called basic cranium, and the apex is called calvary. Don't forget. Don't forget. They connect. You don't learn in isotom. When you're learning something, you connect. Okay. So we're done with that. I do love cool brains. That is introduction. Stands for introduction. Okay. Diagram. Content. Boundaries. Okay. You don't say blood supply, called boundaries. Okay. Because real anatomy, that's base, apex, fuse, that's floor, beautiful, that's boundaries. Okay, if I mentioned base before, I mentioned boundary. Beautiful, like charming ones. The like there is the what? Is the lymphatic drainage. Okay, lymphatic drainage. And then charming one is the clinicals. Okay, so I've given you the second thing you need to know about spaces. That's the outline. So write in the comment section if you can see the outline I'm doing. Write in the comment section. Okay, so okay, so now that we've gotten this, we are not going to take time in this. Very shortly we are going to end the session. Okay, so we've started. um, okay, sorry about that. Okay, so now we have anatomical spaces in the body. Repetition brings retention, and this one gives you in a column. We try to look at different interesting way of making this uninteresting anatomy fashionable, entertaining. Right? That's why we are approaching what we are approaching the way we are approaching. Do you follow? Eh? Thumbs up if you are with me. So we're looking at the children program aspect. Okay, doing it like a cartoon, like anime, something you like. And then we're also looking like African story, like epic story or action movie, like we're still thinking of better way to make sure that this anatomy, which you already know a little thing about, okay, at least the sound, okay, it can be interesting. Now look at the upper limb spaces, axillary space. The axilla is a space, okay, clavipectoral triangle, cubital fossa, quadrangular space, triangular space. okay, triangular interval, anatomic snowball, carpal tunnel, Guyon's canal, where the ulnar artery pass through, and palmar spaces, example, tenal, mid-palmar, and all that. Okay, so for the lower limb, you can see it here, all right, femoral triangle, femoral canal, abductor or contas canal, popliteal fossa, and tarsal tunnel. We have carpal tunnel in the upper limb, and we have tarsal tunnel in the lower limb. Okay, so the next one there, we have what do we have? We have thoracic spaces, pleural cavity, and we've been doing pleural. If you have not watched the video on pleural, go check it out. Been doing pleural, and then mediastinal spaces, okay, pericardial spaces, and costodiaphragmatic recesses. Okay, recess and space. Okay, talk about the recesses. Abdominal and pelvis. Okay, abdomen and pelvis, peritoneal cavity, you can see retroperitoneal space, sophrenic space, paracolic gutters, pelvic cavity, ischial fossa, perineal pouches, rectouterine pouch, vesico vesicouterine, retrovesical, vesicouterine pouch, and rectovesical pouch. Okay, now you see this one now. The truth is, even me that is reading to you, I'm forgetting it, let alone you that is listening or that is watching and not. Okay, can see two people have given thumbs up, only two people. See, if you watch this, you give thumbs up. Okay, let's get to know the mistake you spotted and all that. Let's hear your feedback, because I noticed one or two mistakes. I just leave it there to be sure if people are really engaging. Are they watching? Is this a more interesting way, or do I do live on TikTok? So I may be switching to TikTok to run live sessions there. Okay, I've already said this for those of you just joined. Okay, so subscribe, like, share, so that can be a blessing to us. Okay, and then you can support this version, this thing we are doing. If you want to support us to keep doing this work, if you find this content, uniquely important, okay, to you, you are seeing here what you are not seeing anywhere else. I want to encourage you to make it a part of duty to see how to contribute, because you can never be remembered for what you consume. Always consuming. You will only be remembered for what you contribute. Do you follow? Okay. So we move on to okay. So this where we are now. All spaces in the human body, we've already looked at this. So let's look at the orbit, for example. Remember when we talk about the orbit, talk about the what? The azomatic bone. Is an azomatic arc here. Okay. Spaces in the face, you can see temporal space, pterygopalatine fossa. You remember the palatine bone? Okay. Okay, so infratemporal fossa, canine space, canine space, that's do with the canine teeth, incisive canal, that's so palatine, that's where you have the incisor in front here. Okay, facial buccal space, what other space do we have? We look at space in the thorax, spaces in the head, okay, and neck. We have the anterior cervical space, the pretracheal space, retropharyngeal space, danger space. So this is just an episode. We are coming with another episode where we are going to create mnemonics from this, and then we'll be sending it across, so that if you want to know all the spaces, remember all these things we are doing has reference. So we're trying to make your textbook and your lecture notes, okay, more easily, more captivating, more interesting. All right, not just pictures. Okay, so he said spaces allow movement, expansion, storage, and passage of structure, especially if you have read of inclusion. You have a video on inclusion. You should go check up inclusion. We have 4 minutes to end this session. Inclusion. It's important in spread of infection, like what you talk about herniation or hernia. Okay. And then it's also important in anesthesia, surgery, and imaging. You see. So that's the point. We're taking time to really compile this, made such course mastery, your pathway to conceptual clarity and excellence. It's not really easy, but you people are really the reason why we are building this. Okay, so that's that for these spaces here. Okay, let's look at another one. You can see this is another comprehensive spaces of upper limb, spaces of lower limb, first incus and incus walk, and see thorax. See, usually what you are examining on is on bone, it's on joint, it's on arteries, it's on that's anastomosis, venous drainage, lymphatic drainage, okay, spaces, okay, nerve, like the brachial plexus is a plexus of nerves. Okay, lumbosacral plexus, plexus of nerve. But yesterday we started with brachial plexus and we said three things you should learn about the brachial plexus. Okay, so you can see spinal canal spaces, spaces in the spinal canal, the epidural space, subdural space, subarachnoid space, central space, foraminal space, vertebral body gaps. Okay, visceral lumina as the power blue gastrointestinal tract, you know, lumen mouth to anus, it's a space, it's a hollow, it's a tube. Respiratory tract, okay, nasal cavity is a space, you see. Bile duct, there are space pancreatic duct, and small joint and meniscus spaces, synovial joint spaces, bose, tenosynovial sheath, and lymphatic space. So that's that about space. That's that about space. We're making progress. See, this is still spaces of the upper and lower limb. You can see lower triangular space, lower triangular space, and see upper triangular space. See, keep your hand this way. Eh? Keep your hand this way. This is the upper, this is the lower. See, keep your hand this way. This man, see man. Okay, so see the upper triangular space. CTA is the way. Contents, circumflex, scapular artery. Okay, so you see, arm here, MBBR, median nerve, brachial artery, bicep tendon, radial nerve. Those are contents from medial to lateral. Okay, so that's that about that. that. Okay, we have a few minutes to end the session. See, still talking about spaces. Still talking about spaces. You know, see, still telling you about the spaces. The twister, the bender, hmm? Accio radialis, pronator teres. Hmm? See, still talking about the spaces. Okay, still talking about the spaces. You see, so there's another one. Hmm? It's another one. You see, lower limb spaces. We have looked at upper limb, the fossa, and all that. The navel. These are contents of the femoral triangle, navel. You see, so leg man. See, or like Ali abductor ligaments sartorius. Mhm. Or like Ali abductor ligaments sartorius. Okay, so knee bone, can see anterior spaces. Now, what have we done so far? We are just looking at this different numbers. Okay. Yeah, this thing. So to really internalize, because you know, keep this short and simple, you go to the video once it's uploaded and watch it. And watch it completely, watch it lovely. Okay, you have the next one. Major spaces. See, so that's that about that. thorax specifically and zoom it in. Okay, for upper limb, and see the diagrams. This one now, about easy diagram of axilla. You can see the space well numbered, the subdeltoid space and all that. So you just need to know all the spaces. See, spaces, 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 still spaces. Okay, so be grateful if you can take your time and still learn about the spaces. All right. So thank you very much for staying to this time. It's a pleasure. We are grateful you're here up to this time. Do subscribe and like the channel. Do share with your social media handle. We meet again soon by I think 3:45 or 2:45. You know the time. Bye bye.